Today I would like to talk about cytokine storm mitigation for exogenous immune agonists. This was actually the very first work that we did in collaboration with Jana Gevertz, and I'm very excited to share it today. Okay, so a bit of background on cytokines. Cytokines are low molecular weight glycoproteins that are secreted by different cells in the body, mainly the cells of the immune system. They have a wide array of functions in the innate and adaptive immune systems, and specifically, they regulate both activation and inhibition of the immune response. So this duality of function is a piece that is going to be very important in this story. Positive feedback loops can become upregulated during an immune response, and these involve complex interactions between cytokines and immune cells. And this can give rise to a cascade of events known as cytokine release syndrome, or a cytokine storm. So notably, while they're often used interchangeably, there actually exists a distinction between the terms cytokine storm and cytokine release syndrome. Cytokine storms typically refer to an acute reaction, while CRS is usually a more delayed response. There is actually a big discussion about qualitative differences between these two responses, how they're triggered and how they proceed, but it does appear that the final qualitative dynamics are actually very similar between the two. So I will be talking here about cytokine storm, but we do believe that the proposed model can actually be used for better understanding of CRS as well. Okay, cytokine storm. It's a physiological reaction in which the immune system causes an uncontrolled and excessive release of cytokines. These things can be caused by a number of infections and non-infectious etiologies. Of course, we're now all very familiar with cytokine storms caused by viral respiratory infections such as COVID-19 or SARS-CoV-2. They can be caused by immune cell agonists such as CAR T cells. That's the story that I'm going to be talking about today. And if you want to have nightmares before you go to bed, read up on the Tegenera case, the calm after the cytokine storm. This was an excellent overview of when we very sadly and almost tragically learned just how bad these things can be if the immune cell agonists are used. Okay, so cytokine storms, they can have life-threatening effects, including decrease in blood pressure, decrease in heart rate, and they actually can lead to death. Now, let's take a closer look at CAR T cell therapies. These are exogenous immune stimulatory anti-cancer therapies, and in general, they work like this. So you collect blood from the patient to isolate their T cells. You add a gene to the T cells for a chimeric antigen receptor, that's where the name comes from, to program these cells to recognize specific cancer antigen, and then you introduce them back into the patient. And the idea is that now you have very targeted T cells that should be able to augment the patient's specific immunity against their specific cancer. These things can be very effective as an anti-cancer treatment. They can have complete remission rates, like one statistic I found was as high as 68 to 93%, especially in relapsed and refractory hematologic cancers. But there is a risk of cytokine storm that really limits the utility of CAR T therapy. So let's kind of take a closer look at the key players in cytokine storms. This is an excellent figure that I found in this paper. The citation is below. Okay, so you get a stimulus. This could be your infection. This could be your CAR T cells. Could be other things. So immune cells get activated. Excellent. They get working against whatever they need to kill, and they start releasing some cytokines like interferon gamma and TNF alpha. That in turn stimulates further activity of other immune cells, other T cells, or also some other macrophages, and kicks in the adaptive immunity. That kicks in further cytokines such as IL-6, which then feed back into the adaptive immunity, and so you can get this cycle, which if it goes out of control, this can lead to your cytokine storms and very bad severe effects. So in a way, these things can start ping-ponging off of each other, so the T cells and the cytokines, even in the absence of the original stimulus. That is at least how we think about the cytokine storms. Okay, so we're modelers, so we want to put together these mechanisms in a mathematical formalization. So started with kind of a slightly bigger model. You have your immune cell agonists that can cause maybe augmented expansion of immune cells, that maybe improves tumor elimination, that stimulates further immune cells, and this activity can then trigger production of some cytokines that can be both stimulatory and inhibitory. And you can also have these interleukins, the feedback loops that we saw in the previous figure. Well, we're mathematicians, so we write models, we reduce the complex biological mechanisms to mathematical formalizations, and so this is what we proposed. We have two versions of this model. So we have the full one, where we have immune cell agonist, maybe comes in, and it increases the expansion of the immune cells. They can now improve there's now improved tumor elimination, so there is this process, and these immune cells maybe start producing some cytokines, which can augment or inhibit immune response, and also maybe you have some of these interleukins kicking in, and you have these feedback loops. We were thinking that, okay, this process probably takes place on a shorter time scale compared to relative to what happens on over here. So we are using time scale arguments to reduce the system to fewer equations, where you really have just your drug, your immune cells, your tumor cells, and your cytokines. So the mathematical formalization of this looks as follows. You have your tumor, so dt. It grows logistically up to carrying capacity K. There is some Ali effect term here. And it can be killed by immune cells X of T. Okay, they cannot be killed infinitely, so you have this saturation term. There is a drug inflow term, very simple formalization of it, but was sufficient for our purposes. So these things, they now go into the immune cell compartment. So you have inflow due to them, you have some normal clearance, you have this positive term, which is a tumor-mediated expansion. As you can see, this is proportional to this kill term in the tumor equation, so proportional to how many tumor cells have been killed by your immune system. We actually had a very long discussion about whether this is an appropriate way to look at this in our paper from a couple of years ago in Pareto to Prey models, whether it's a wrong model or just incomplete. So if you want to look at it in more detail, please check it out. And then we have this added term. So let me go through this. The idea here is that you will have cytokine-mediated expansion and regulation of immune cells if your immune cells are above, so the volume of the immune cells, above some threshold. So if you have your cytokines, Y of T, are above threshold Y lower, but below threshold Y upper, then this is a positive term. So you get extra immune cells kicking in. If your cytokines Y of T are above the threshold YU, then you get reduction. This term becomes negative. And the idea here is to capture this regulatory and inhibitory property of cytokines on immune cells. Okay. So, and then here we have our cytokines, so we assume there's some kind of a normal turnover, and also we do assume that the immune cells can stimulate cytokines. So what you have here in general is that immune cells can stimulate cytokines, and cytokines can both stimulate and regulate the immune cells. Okay, so the key parameters that determine how these cytokines and immune cells effectively ping pong off of each other, even in the absence of original input, are these. You do not need to do fancy sensitivity analysis to just be able to see this from the system. The rate of cytokine-mediated expansion of immune cells, the rate of immune cell-mediated expansion of cytokines, and the two thresholds, Y lower and Y upper. At least in this formalization, these are the key players. Okay. Now let's study this system. So first, can we have storm without efficacy and efficacy without storm? That was the first question. So what do we have here? So this was kind of the test case, no drug, to show that yes, the immune system is not really doing anything to eliminate the tumor in the absence of intervention. So the top panel is the tumor, then it's the immune cells over time. Third one is cytokines over time. This one is cytokines versus immune cells. So we'll see why this is important. And the bottom one is the drug. Okay, so now I'm giving 10 units of some simulated CAR-T dose, not working with real drugs, just proof of idea, proof of concept. So giving a dose of 10. Okay, so the immune cells kick up, but not very much. This is okay enough to just kind of bring this down a little bit, but everything rebounds. Okay. Nothing really was sufficient to stimulate the cytokines. The cytokine versus immune plot looks flat. Okay, this is my drug. Okay, dose number 20. So dose value of 20, now we're doubling this. Okay, this is now seems to be sufficient. So you have enough immune cells to eliminate this thing. You have cytokines that, okay, we crossed the threshold Y lower, so we were able to give an extra little boost to the immune cells to actually clear the tumor, but everything stayed below Y upper threshold, and everything kind of looks good. Everything went back to equilibrium after the tumor was eliminated, and you have this small loop here. This is the drug. Okay, now we increase the dose to 25. Okay, we still have tumor elimination, but now we actually have this very big spike in immune cells, and you have this really big spike in cytokines. And you get, so in the cytokine versus immune plot, you get this big loop where actually you see going above the YU, so this huge loop, and of course the drug. And this is what we interpret as cytokine storm here. So the notes that I have here, yes, cytokine storm can be visually identified on this immune cytokine plot as a loop that surpasses the threshold YU. So proposed way to look at it. And we do observe that a single dose administration of the drug can actually achieve efficacy without the storm. So this is our dose 20. But the magnitude of the dose must be carefully monitored to decouple efficacy from storm. So you can have insufficient dose, no efficacy, no storm. You can have efficacy without storm, and you can have efficacy with storm. Okay. So next, let's look at the impact of dose frequency. Now, we realize that for CAR T cells, usually you're just dealing with one dose, but for the sake of kind of exploring all the possibilities. So we take the case where we had a single dose. Okay, that was ineffective, that was not great. But now let's see if we can give the same dose, but in this case 336 time units apart, some kind of amount of time apart. Okay, so this seems to still not be enough. Yeah, you bring it down a little bit. Okay, not working as well, so we could interpret it as resistance. And okay, everything goes back up. This was insufficient. What about if you give them a little closer together? Okay, now we're cooking. So now we have this is sufficient stimulation of the immune system, no storms, but tumor elimination. And then finally, if you give them too close together, so they start actually ping-ponging off each other, like growing too much here. You get immune cells, the cytokines going up way too high, so you get our cytokine storm loop. And yes, you have efficacy, but you have storm. So what does it say? Low doses can be efficacious without causing a storm if they're administered at an appropriate frequency. Okay. Next, impact of initial tumor size. This is kind of intuitive, but still helpful to see. Okay, so we're starting with dose of 10 given twice, and you start at t equals 200. And so the two simulated tumor grows to some volume. Okay, here we know 2 doses, that works. Excellent. But if you initiate your treatment a little later, so the tumor size is actually a little greater at this point. And so now, same dose, same schedule, but that doesn't work because this is now insufficient to kick up the sufficient immune response for this tumor size. Now, if you increase the dose a little more and start at this time, okay, this is still insufficient. It seems like because this was not enough of a boost to actually get the cytokines to start helping out with augmenting the immune response. And then finally, okay, here we simulated, for example, kind of lower dose, but given 3 times, starting at this point, and now we have elimination without a storm. I mean, it intuitively makes sense. You have a larger tumor to eliminate, you need stronger immunity to do it, but still it's helpful to visualize that this is important. So what do we have so far? We know that we can have efficacy without a storm and storm without efficacy. If you're able to administer more than 1 dose, which is for CAR T cells at least, is typically challenging, they're hard to manufacture, but still you can have efficacy with low doses, so probably lower likelihood of storm. Initial tumor size matter for efficacy. Okay, so if you were to summarize this, you can have 4 potential outcomes. We can have efficacy and no storm, You can have efficacy and storm. You can have no efficacy and no storm. Or you can have no efficacy and storm, the worst possible outcome. Okay, so now we know we can, at least all 4 regimes theoretically can occur for the same dose depending on the characteristics, if you remember some of those parameters that I talked about before. So we can, as I said, we define a storm as having occurred if the cytokine levels surpass this upper threshold YU, so right here. And we define treatment to be successful and effective if the final tumor volume is at least 90% below its carrying capacity. So we chose this arbitrarily because we need to quantify, kind of doing this parameter sweep and dose sweep through the system. So we need to fix these definitions. You can relax them, change them for whatever you're using if you end up using this. Okay, let's look at what we have here. So on the x-axis, we have the rate of cytokine stimulation, so BXY, so immune cells stimulating cytokines, how much that happens. And then on the y-axis, we have the rate of tumor cell killing. So how effective, once these immune cells are there, they are at eliminating the tumor. Okay, so these were chosen, I mean, these are sensitive parameters, and also intuitively, kind of, if you think about it, what are the things that matter? Well, they matter how much these things ping pong off each other, and also how effective these immune cells that you now introduced into your system are at actually killing your tumor. And see, you can have all the regimes actually occur with the same dose depending on the individual characteristics. You can have effective treatment with no cytokine storm. You can have effective treatment but with cytokine storm, so okay, not amazing. You can have ineffective treatment without cytokine storm, at least no harm done. And you can have ineffective treatment with cytokine storm. That's, of course, the worst possible scenario. Well, so can we do something about it? Can we maybe mitigate it through dose modulation? And the way that we tested this, so we wanted to simulate impact of dose fractionation. That is, we fix the dose, and then we divide it over different time intervals to simulate mitigation of toxicity, or in this case, whether we will or will not get a cytokine storm. So, okay, let's look at this. So what do we have here? So here we have this region. So we have kind of this intermediate number of doses and intermediate kind of spacing between them. So the number of doses is intermediate. So if you have one dose, if you divide it into few, so it will be larger doses. Here, if you divide into many, obviously it's going to be a lot of small doses. So here, kind of, okay, you have a pretty big region where you can have effective treatment with no storm if you find a sufficient number of doses that are given sufficiently far apart. Although here it doesn't seem to matter very much. Okay. So you can also have effective treatment, but cytokine storm does occur, kind of less ideal. So that happens if you have few larger doses, and it doesn't seem to matter how frequently you give these things. And this one, this is ineffective treatment, but no cytokine storm. Okay, so a lot of small doses, insufficient to clear the tumor, insufficient to stimulate the immune system. So, but there does exist this sweet spot in the dosing space that can give efficacy without a storm. And this is just a summary of what I just said. If the number of doses is too small, so really high doses, no fractionation strategy can really prevent a storm. So you can see, you can divide, you can give them as frequently or as closely or as far apart as possible as you want. It doesn't seem to matter. This intermediate dosing space is really the sweet spot where you can have schedules that work without a storm, and for many small doses it's actually efficacy that becomes concern. So, and if the doses are actually sufficiently close together, the treatment can be effective without a storm. So this region over here. So if one were to test out things, to devise strategies, this is maybe something to think about. And of course, if the doses are spread out too much, treatment is unlikely to be effective. We saw that in some cases that I showed earlier. Okay, so now the way that we define a storm here is that it goes above this particular threshold. But actually, despite its importance, precise quantifiable definition of cytokine storm actually remains elusive. So we found several. For example, these authors, they focus on absolute levels of cytokines as a strong correlate of cytokine storm severity and survival in murine models. That's the approach we took. These authors look at fold change of cytokines rather than absolute values as markers of cytokine storm severity. Li et al. Look at relative rate of change of cytokine levels, maybe as a good marker. So this is a model. We can test hypotheses. So to discriminate between these, we actually conduct simulations where we define the storm as either based on absolute levels of cytokines, so the very first definition, or the rate of change of cytokine expansion. And that was actually a little unexpected, but also pretty great. Within the frameworks, at least of this model, projected cytokine storm occurrence is essentially invariant to either of these definitions. Out of over 14,000 parameterizations that we checked for these with these different definitions, only one flipped classifications under the rate of change definition. That is pretty remarkable and kind of unexpected, but also very good to know. Okay, so kind of as an emerging picture for the storm/efficacy versus dose frequency trade-off. Just to summarize what we saw here. So on the x-axis we have frequency, increasing frequency. On the y-axis we have increasing dose. Okay, so insufficient dose, regardless of frequency, no efficacy, no storm. Okay, now if we start, so low frequency but increasing dose, well, there's a possibility of no efficacy but having storm. So frequency might actually be important. Then there's a sweet spot where you can balance out the dose and the frequency. So if you're able to give more doses, so then maybe you can get away with giving few. If you are stuck with giving only few, well, yes, you have options here, but you just gotta really look for this and find the sweet spot. And then if you are really high dose, high frequency, well, you can have efficacy and storm, kind of the worst possible scenario. So it really is a balancing act. Of course, this is completely theoretical, but in theory, these are the things that we should be really checking and balancing out. This was published, so this is the preprint, but the actual manuscript now already came out in this paper, in this journal over here. We actually did a preprint with a virus-induced storm model, so slightly different application, but general structure of the cytokine storm model is very similar. If you have experiments or thoughts on how to test any of these proposed concepts, reach out. We are always very happy to chat science. I am. So please do not hesitate to reach out if you have experiments, data, or science talk. Okay, thank you very much.